Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. April is Oral Cancer Awareness Month, and in today's video, I wanted to raise awareness of some of the many different types of oral cancers. But before we get into it, just a quick disclaimer that all opinions expressed in this video are mine and mine alone, and do not represent any organization that may employ me or that I may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. Cancer occurs when cells go bad or start dividing on their own, creating invasive, sometimes aggressive tumors. Any normal cell in the oral cavity could potentially become cancer, and I wanted to highlight the different types of oral cancers that can occur. The most common oral cancer, which represents over 90% of oral cancers, is squamous cell carcinoma. This occurs when the cells of the surface mucosa become cancer and invade into the surrounding tissues. According to most studies, the second most common oral cancer is lymphoma. Lymphomas occur when the white blood cells that are present in the oral cavity start multiplying and creating tumor-like masses. The next most common type of cancer in the oral cavity is salivary gland cancers. The salivary gland consists of acini, which create the saliva, and different types of ducts that move the saliva to the surface. There are many different types of salivary gland cancers that can involve one or more of these normal structures. The most common type of salivary gland cancer in the oral cavity is mucoepidermoid carcinoma, which involves both mucus cells and epithelial cells from the duct. There are many others, and I plan to create a more comprehensive salivary gland cancer review in the future, so be sure to subscribe to this channel so that you don't miss any future videos and oral pathology insights. Beyond these categories, we have more rare cancer types. When cells of the surface become cancer, we call them carcinoma. And when cells of the connective tissue become cancer, we call them sarcomas. Let's take other normal cell types. Under the surface in the oral cavity, we have fat, blood vessels, muscle, and connective tissue. When fat becomes cancerous, we call it a liposarcoma. Blood vessels are composed of smooth muscle. In health, this muscle helps make sure that blood moves smoothly and continuously through our arteries and veins. When these cells become cancers, we call them leiomyosarcomas. Our oral cavity has a lot of skeletal muscle. These muscles help us speak, chew, and express emotions. When these cells become cancerous, we call it rhabdomyosarcoma. This cancer is especially important in children, as it is the most common soft tissue tumor in children, and the most common site for this tumor is in the head and neck. This is why I usually recommend that all unusual lumps and bumps in children undergo biopsy, because it is very important that we don't miss this cancer in kids. There are many other types of sarcomas that can affect the oral cavity that arise from cells within the connective tissue, but these are some of the most common. Perhaps one of the most surprising types of cancers of the oral cavity arises from the structures that develop into teeth. Teeth are made of both epithelial or surface components and mesenchymal or connective tissue components. Therefore, you can see odontogenic carcinomas, but you can also very rarely see odontogenic sarcomas. These are just some of the many different types of cancers that can affect the oral cavity. While squamous cell carcinoma is far and away the most common type of oral cancer, I also wanted to take the time to raise awareness about all of the other types of cancers that affect the oral cavity and honor the patients that have faced these diagnoses as well. Thank you so much for watching, and I do hope that you found this video informative. If you did, be sure to share it so we can spread more oral cancer awareness this month and every month. Thanks again for watching, and be well.